You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants to restore missing teeth or loose teeth. In fact, my first guest says no more need for dentures with dental implants. With us, we have an expert on the topic, Dr. Rick Kline. Dr. Kline, welcome to the program.
Thank you, Randy.
Now, for people that don't know your practice, you've been on the program before, who's the typical patient? Because you kind of focus in your practice. Is that right?
We're very focused in our practice. Randy, we really only do two different things in the practice. We create beautiful cosmetic smiles using cosmetic dentistry and do smile makeovers.
Okay.
And we also focus, my focus in the practice is on dental implants or replacing missing teeth with dental implants.
Good. Jumping right into it, who is the typical patient that is coming in for dental implants? Like, if you had to categorize the different types of patients, what are they?
Well, there are several types of patients that come for dental implants. It might be somebody that's missing just one tooth and they don't want the two adjacent teeth trimmed down to have a conventional bridge.
Okay.
And then we have patients that are missing 2 and 3 teeth, maybe in a quadrant, maybe it's their back teeth. And with those patients, we can use dental implants to put on a custom cosmetic bridge or restore those teeth with implants so they can chew again. And then there's people with gum disease. You know, they've got bleeding gums, they've got bad breath, Randy. Their gums hurt, and they know that their teeth aren't going to be with them very much longer. They're loose teeth. Those patients are ideal candidates for dental implants, and they come to see us to have their teeth replaced with dental implants. Okay. And then, Randy, there's a percentage of people that they're in trouble. Their teeth are in bad shape, and they know they don't want dentures.
You say they come in and they go, "Doctor, this is the worst I bet you've ever seen."
Randy,
you hear that all the time?
That happens almost every day. And most of those people are very embarrassed to come see us. In fact, it takes a lot of courage because it's such a personal thing to them, and they're so self-conscious that they have a hard time even reaching out and coming to us. And we don't judge people, Randy. We are here to help people at Smile Texas. And those patients, those are our most fun cases because they go home with a beautiful set of gorgeous teeth. And they never thought that was even possible to have.
I mean, but you say that you transform people's lives.
Randy.
And I always think, I think I kid you about this. Is that an exaggeration?
Randy, that's no exaggeration. They tell us that it's how it transformed their lives on a daily basis. I mean, you see those patients coming in that have renewed self-confidence, that start taking better care of themselves physically because of the change in their smile, that it's impacted their lives. They've gotten married, they started dating, they started playing golf again. They start plugging back into life again. And it's really an amazing transformation.
Now, for the denture crowd, upper, lower denture, is that a big problem where you are, by the way? I mean, would you say there's tens of thousands of people?
Even in Houston, Texas, in this day and age, I could fill our football stadium with people that are still having and struggling on a daily basis with partials and full dentures.
Really?
It's still a big problem.
Because you say nobody should be wearing the standard kind of dentures. Is that right?
In this day and age, really nobody should have a complete denture anymore, a full denture anymore.
Like they should all be held on to or snapped in or something with dental implants.
Randy, I'll put it this way.
So I have this right.
If we could just magically give each one of those denture wearers the possibility of having fixed teeth for a weekend, and letting them experience that for a weekend, nobody would want to go back to the denture after the weekend's done. Let's just say that.
Okay.
It's that big a deal for those patients' life.
And what are the age? I mean, how old can you be to get a dental implant?
Well, there's no real age limit for dental implants. It's really based upon the person's health. I've done many patients in their 60s. That's probably my average patient, actually,
okay.
Randy. And then 70s and 80s, and I think our oldest patient is well into his 90s. And it's funny, it's hard to keep up with these people once they get their teeth restored with the implants because they're plugged back in. They're out there living life again. It's that big a change for those patients, especially our seniors that are reaching the golden era in their life, the fun years. They've raised their kids, they've retired, and they want to start continuing to live their lives again. And with that denture, it was like the slow downward spiral and decline. And for them to change their lives with implants and get them eating really healthy food again and get off the Metamucil, Randy. You know, most of those patients go to their doctor, they say, yeah, you need more fiber in your diet, and you know, they're trying to struggle along with the denture.
When it's all done, is this one of those things where they'll say, doctor, I should have done this a long time ago?
Well, it's really interesting. You know, most people that have dentures stop going to see the dentist. So they really don't know, you know, that implants exist. If that denture's not hurting or pinching or they don't need a reline, they don't go to see a dentist. So when they do explore the possibility of having their teeth restored with dental implants, you know, then that really dramatically impacts their life again.
I was not happy with my smile. There were a lot of issues with the way it looked, and it just didn't look good.
The biggest thing was bringing me to Smile Texas is I wasn't happy with my smile, wasn't comfortable. There wasn't any pictures where I was going in, and you would never see my teeth. My life has definitely changed since I've had my work done here at Smile Texas. I'm not scared to smile. I'm smiling in all my pictures. There's not a week that goes by that if I don't meet somebody, they don't compliment my smile. And that reinforcement right there is knowing that I did the right thing.
When I saw my smile, I literally started crying. I was just blown away.
My biggest mistake is I waited 10 years to come meet with them. You know, I've had multiple people that have come up and talked to me about it, and they are going to be future patients of Smile Texas.
I've had dental issues all of my adult life. I did a lot of, this kind of talking because I was embarrassed.
Similar to my father, I would often cover my mouth. So when we had family pictures, I would always close my mouth. And now I smile. It has changed my life and has been one of the best things that has happened to me. I'm so grateful.
See, I get a big kick out of her mouth because I can't see mine. But I know what mine looks like when I look at my daughter.
No, mine's better.
Well, okay, it is. It's prettier than mine, but I enjoy seeing it.
So we're talking about dental implants today. But
Yes.
these, like snap-in or fixed set of teeth dentures or overdentures, whatever you call them, they also look real. I mean, they look cosmetic. Is that right?
Yeah. Let's take a look. Let's
All
take a
right,
look at an
all right.
example. This is a lady that came to see us from West Texas. She works with kids all day. She felt like, her appearance was holding her back. She didn't feel like she was appearing friendly enough to these young children.
Okay.
She also felt like she was kind of in this point in her life where she wasn't really happy with her looks. And if you look at
They tell you this on the consult?
they share these very intimate details about themselves at these consultations.
Okay.
And it's really, it really gives us a lot of insight on how to help these people. And once we know what their concerns are, then we help design a specific treatment plan that will help them in their lives.
So with this woman, what do you see? Like, what's going on there?
She's got worn teeth, Randy. She's got worn teeth. It makes her look much older than what she really is. She's got missing teeth, and this is a patient that's missing a few teeth, but it's affecting her chewing.
Okay.
In her particular case, look at the difference, Randy.
Wow.
If you look at the before, she looks kind of tired. You look at the after, she looks re-energized, renewed, renewed.
Yeah.
It's funny. After she left our office that particular day, she went to the local hotel and was having a cocktail after the procedure, and she had these men noticing her all of a sudden, and she couldn't figure out why. She was smiling again. She was proud of her smile, and people noticed that, Randy. When you walk around with a frown or you don't smile all day long, people assume things about you, that you're not friendly, that you're not outgoing, that you're not approachable. And when we changed her smile, all of a sudden, it just kind of lit up her personality. But it's also interesting, people start changing their hair color or
see this?
taking better care of their hair or their
And all you do is
skin.
you fix her teeth.
We fix her teeth.
And-
it's much more than their teeth.
Okay.
That smile is a gateway for them to start feeling better about themselves.
Okay.
And their attitude completely changes. And they feel really differently about themselves. Many of these people...
Well, she looks pretty in the after. I mean, she looked pretty in the before, but I mean, she looks very nice in the after.
She did, but certainly she looks much younger, much more vibrant,
Yeah,
much more
yeah.
approachable. I'm sure when she's smiling at the children she helps every day that they feel that different energy from her. And it helps her.
And those are
really
dental
connect to those
implants. It's like a
kids.
combination of dental implants.
Dental implants and cosmetic dentistry.
Okay.
You know, we solved.
So
you know,
she
we
was
solved the
missing a lot of
problem.
teeth?
She was missing several teeth in different areas, and we replaced those with dental implants and used beautiful cosmetic dentistry to get her smile back.
Because it's not expensive. I mean, it doesn't cost more to go to a guy like you.
No, it costs no more than going,
To somebody that took
down the street.
Okay.
Yes. And we want to try to make this affordable for everybody. We want to try to help everybody and get the individualized solution, for each individual patient based upon their desires, their budget that
Okay.
they're working within, and things like that.
Okay, for the sake of time, what else do you have here?
Okay, let's look at another one, Randy. This is a great example of somebody that's missing their front teeth, and I call those the social teeth, the social six, the ones that
Okay.
everybody see, okay? And he had a partial, and he hated to have all this bulk of a partial in his mouth to replace his few teeth. It was the front six teeth, Randy. And he, like the patient we just showed you, had completely ground down his teeth, just to nubs. And he kind of lost hope in his smile. And it was really his wife pushing him to go investigate. What
Is
they
that
can do.
common?
Is very common. In fact, usually the wife or the significant other is the motivator that gets
Because
them.
guys put things off, right? To the
Gu-
last minute.
The first 10 years, I'll put it this way. The first 10 years I practiced on 70% women, okay? In the last 10 years, it's been 50-50, Randy.
Okay.
And that's usually because there's a push, a gentle push sometimes, a shove other times from the spouse. And in his case, again, we use implants in the front of his mouth and cosmetic dentistry to restore the worn bite, the collapsed bite. And we revitalized his smile and giving him a natural looking smile that he's very proud of and that his wife loves, by the way. And it's kind of rekindled their connection and their relationship, and because he feels better about
He
himself.
looks great in the after, by the way. And what a difference.
That's a huge difference, and such a huge and lasting impact in his life. He's going to be able to eat the foods he wants. He's going to be able to smile at people with confidence again. He's going to be able to, interact with, children, grandchildren, and be confident with people in general. And that's a huge impact on these people's lives. Here's another patient.
Okay.
And, I know when a person like this comes to my office, I'm over the top excited to help this person because I know it's going to be good. I know we're going to have a
You
great
know
result.
it on the
I
console.
know it. They don't know it yet, but I know it. I know what they're going to look like when we're finished.
Okay.
But she came to our office and she had her daughter's wedding she had to get ready for. And she wanted to be able to smile in her wedding photos. And she wanted to be able to experience that wedding and smile with confidence and be able to eat wedding cake. And she also is a business owner and she has to interact with people on a daily basis. And she was getting very self-conscious about her teeth. And she's a pretty lady. She's got pretty features, but the smile was holding her back. She came to us and she knew that her teeth had to go. When she was chewing, her teeth hurt, her gums bled. She knew she was not in good shape. And
Headed for dentures or false teeth.
headed for dentures, and she knew she didn't want dentures. She didn't want false teeth. And she knew she needed a different way. And in her particular case, we were able to solve the problem with the gums, by getting the teeth out, and the teeth are the source of the infection or the nidus infection. We got the teeth out, we cleaned up the infections in gums and bones, and we used dental implants to give her a fixed set of non-removable teeth. Actually, it's called the all-on solution, where we use just 4 dental implants, Randy, to replace a full arch of missing teeth, all in one day. And
Is that
it's a more advanced procedure. I've been doing it actually for over a decade. And it's a
So
phenomenal.
4 implants and they get like a full arch of teeth?
Just 4 implants. I know
Is that what you did for her?
That's what we did in her particular case.
Nice.
And you can see what she looked like before and what she looks like after. That's a major transformation.
You said earlier she was a businesswoman. And I'm not trying to side with you, but on the after, it's like now she looks like a businesswoman.
Now she
It's
looks
interesting, very interesting.
much more put together, much more confident. It accentuates the rest of her features. Now you start to notice her eyes and her kind eyes and smile. And it just really adds to her overall look. But it doesn't detract, it doesn't overpower, but it looks like it belongs. It looks like it should be there. And it really gives her that confidence to feel really pretty again.
What about pain? I mean, it seems painful.
And that's probably one of the biggest reasons people do not come to see me because of fear of pain.
Okay.
And Randy, most of them have gone through a lot of pain. You know, they've gone through decay and root canals and gum disease and bleeding gums and bad breath before they ever walk in our door. So they've gone through all of that nightmare already. And they're really worried about, do I really want to do this again? And with today's advancements with dental implants, in our office we do IV sedation. We have an anesthesiologist on staff that actually puts that person to sleep during the procedure.
So there's no pain for sure during the procedure?
There is no pain during the procedure. And, you know, let me tell you, you know, after the procedure, you know, they've got some soreness for a week to 10 days. Most patients, though, just really don't take nothing more than Motrin 800 for a few days after the procedure for the soreness. Some people take nothing after the procedure.
So for some people, there's really very little pain.
About 20%, they may take one Motrin because they think it's going to hurt, and then they take nothing. Yeah, of course, everybody's a little bit different.
Yeah, I mean, I told you in the green room, my father had dental implants on the lower. He said, Randy, did not hurt at all.
And that's not...
So you hear that? That's not totally uncommon?
We routinely hear that.
Okay.
You know, they can go out that same day when she went home, she ate a nice soft meal that same day. You know, she comes in the morning, same day teeth, goes home, eats a nice light meal that same day. We keep them on a soft diet for a couple weeks, and then over a period of a few weeks and months, you know, they can eat anything. Can you think about it? You know, she probably was eating carbohydrates, you know, soft foods, non-healthy foods, and then after the implants are healed, then
so she could tear into a steak or whatever?
Steaks, you know, al dente
like
vegetables.
A carrot? What about a carrot?
She can eat carrots. She can eat corn on the cob. She can eat anything she wants. Once we're finished with the case.
Do they tell you that? Do you ever hear food stories?
I hear food stories all the time. I see the results of doing this. Sometimes, you know, certain patients, you know.
They gain some weight?
They gain some weight, you know. But that's okay because they're eating healthy foods again.
Well, I've had dental concerns my entire life. My family history, there was always dental issues. My front teeth were worn down so badly that, you know, the teeth were almost not there anymore. In the back and sides, I had missing teeth. It was making it more and more difficult to chew. And of course, self-esteem and all that was certainly going out the window. I was just embarrassed to smile with any confidence at all. And so I more or less pulled back from social events. As soon as I had these teeth put in, now I'll stay out too late because I'm out every Friday and every Saturday night now. My self-confidence, my self-esteem was restored to a level I'd never thought possible. The embarrassment that I had over all these years, all of a sudden turned to, look at me now. Whatever you do, please don't wait. Waiting does not help the problem, doesn't help the situation. When you find someone like Smile Texas and you think they're confident and capable of handling your situation, please go to them.
You say, I think it's in your advertisements or on your website, teeth by tonight.
Teeth by tonight was a procedure that I started about 13 years ago because we didn't like patients having to have the dental implants installed and then having them to wait many months. We wanted the same success rate that we had with traditional dental implants with putting the teeth on them the same day. And I was able to achieve that, Randy. And it's quite a miracle because, you know, that takes the downtime, that takes the healing time and condenses this all down in their treatment down into having things done in a day and getting those teeth on that and then having the implants heal over a few months and really shortening the period that the patient has to be inconvenienced.
So there are people that can walk in, I mean, you've got the basic imaging and that out of the way, but they could walk in one day without teeth and walk out with teeth. You say that.
We do it all the time. You know,
Okay.
almost every other day in our office.
I mean, aren't they skeptical though? I've asked you that earlier, but I mean, did they say, can that really happen?
Yeah, people are very skeptical about that. They say, show me, tell me about that. I want to see that.
Okay.
But it's something we routinely do and have done for over 13 years now, and have done thousands and thousands of these with an amazing success rate. Nearly 100%.
So you could be in your 80s, and it doesn't matter.
It does
They're
not
not more
matter.
likely to fall out if you're 80 years old?
No, as long as you're, healthy enough to, basically walk from your car into the office, more than likely you can have dental implants.
Have you had to turn, what about not having enough bone? Because isn't it true that if you've been wearing dentures for a long time, you can't get dental implants? You don't have enough bone.
That's not true.
Really?
Every year that you wear a denture or partial, you will lose bone. The studies have proven that. But we find today there's almost no one we can't help. As a matter of fact, Randy, people are told almost every day they don't have enough bone for dental implants.
At other dentists?
At other
Okay.
dentists. But that's not true. They come to see us and we evaluate them. We do a 3D CAT scan, meaning we can see their bone in 3 dimensions now.
Okay.
So we can tell them in much greater detail versus a standard x-ray, how much bone they have, what the density of the bone, looks like. And that helps us, restore those patients with dental implants. Many times though, they do not need grafting. We can, with a more advanced techniques such as the all technique, where we use
All is like
just 4 implants.
like a full arch of teeth that is on the lower, what about the upper?
Upper too. The
Okay.
great thing about all the sinuses have dropped or expanded. Before we had to lift the sinuses back up, rebuild the bone underneath the sinuses, and then place the dental
Okay,
implant.
we have time for a couple more photos.
Absolutely.
And we're a little rushed for time here.
Let me tell you about this particular person.
Okay.
Failing teeth, missing teeth. He knows he's in trouble. We want to help him.
Okay.
We were able to get the teeth out, get the bad teeth out, restore him with dental implants, and plug him back into life. Before, he was staying at home. He wasn't.
So they become withdrawn, you're saying? Because of, like they're embarrassed of their teeth?
They're embarrassed of their teeth.
Is that
They're
what-
not confident. They're not.
Okay.
He wants to be able to smile. He wants to be able to talk. He wants to be able to be close to somebody.
Okay.
Something as simple as a kiss, is important. Being close to somebody, that is important.
Mm-hmm.
And if you look at the before and after, I mean, we had to teach him how to smile all over again.
He looks good, by the way.
But the great thing is now I see him out on a Saturday night and he's out dancing and having
Okay,
fun.
you've seen this guy.
I've seen him out on a Saturday night, and he's out on the dance floor, and a good-looking gal on his arm, and just enjoying life.
Did you guys end up, does he know you saw him?
Absolutely.
Okay.
We talk.
Did
of
he say,
course.
hey, don't mention my teeth?
I'd
to my-"
never. I zip it up. I don't say anything, but I enjoy seeing him enjoying his life. Let's look at another patient, Randy.
Okay.
I call Jim. He's like our grandfather to our practice.
Okay.
Jim came in and he was having lots of problems. And Jim he's a business owner. He likes race cars. He likes having fun in his life, but the teeth were holding him back.
Okay.
The teeth were holding him back, and so we had to get all of his teeth, out, everything cleaned up, and we restored him again with dental implants. Now the interesting thing about him is he loved his teeth so much, he then sent his daughter, because his daughter genetically had inherited, his dental
So it was all
problems.
said and done. So this guy now has this great teeth and he's telling his daughter. Okay.
He's telling his daughter.
Okay.
I mean, he's telling her, hey, let's get this fixed now before it becomes a big problem later. So we fixed his daughter, and the daughter loved her teeth so much, then encouraged her brother to come.
All right.
And then we restored the brother. So it's not uncommon that we have, members of families, coworkers that send their coworkers in because they're so happy with what we've done with cosmetic dentistry and what we've done with dental implants. But one point I'd like to make about this guy, now that he's had his teeth fixed, he's ripping into a steak. He's eating.
He couldn't do that before?
He could not do that before. I mean, you think about it, it's like almost like a cow chewing. They're just rubbing food together.
Okay.
And now they're tearing their food apart. Now they're eating all the things they want. Let's face it, Randy, everything's, I hate to say it, centered a lot around food.
Okay.
We meet friends at restaurants, family reunions, everybody brings a dish. Food, being able to chew is hugely important. Let me show you another patient, Randy.
All right.
Talk about a transformation of a person. Wait till you see his
Wow,
after.
that's pretty bad. I mean, that's got to be unusual.
Randy, that's not unusual at all. I mean, he walks in the door. He is a typical person that walks into our office. They haven't been smiling. They are that self-conscious about their teeth. And if you look at the before, we got loose teeth, we've got missing teeth. You can't hide that.
Okay.
So you hide behind your smile, And if you look at the after and compare it to the before,
Wow.
If these were two brothers coming for a job
Like twin
interview,
brothers.
twin brothers coming for a job interview,
Okay.
which one would you hire? I mean,
Well, one looks positive, since you mentioned it.
he looks more positive. He looks smarter. He looks more
Yeah,
confident. He looks more polished and professional.
Yeah.
You know, it's a huge change in that person's life, and it takes them a little while to get used to, that amazing transformation.
In our green room, you were trying to explain to me, say, Randy, this is more than just dental implants. This is more than just teeth.
And Randy, I know
And it
you're,
is, I
you're very
guess-
skeptical. It's just a smile, but you've got a great smile, Randy.
Yeah, maybe I take it for granted.
Let's just take one of your front teeth out and see,
Okay.
see how that would impact your career. Just like, most people. I mean,
Good.
it's a big deal. It's a big deal.
So there's lots of people that are doing, and we're out of time, but there's lots of people that you're saying are doing nothing about their teeth. They put it off, they're miserable.
Right. Okay.
And what do you say to them? They're watching this.
the-
Maybe their teeth have to all come out, or maybe it's a denture wear.
no matter what your situation is, these people are typical of who come to us. And what I like to do is I'd like to invite these people to our office to do a complimentary exam and give them options, because most people don't know what their options are. That's the biggest thing. They don't know what the possibilities are. And we will sit down with them, and I will sit there and one-on-one, examine them and visit with them and give them their options. And there's no obligation to come and meet with us. But, we are passionate about what we do. We love what we do. We love helping people. Randy, do I have time to show you
Yeah,
just
one
one
more,
more case?
one more.
Okay. I love this lady.
Okay.
She came in, she had sore gums, she had discolored teeth, she was in pain, she hated her teeth, Randy.
Okay.
And, I kind of like saying we helped her get her groove back.
Okay.
Because she came in with a swagger and just a different presence after we transformed her life with implant.
Well, it's a beautiful
dentistry.
smile, by the way, right?
Thank you very much. But it's, again, beyond the smile. It is changing that person's life to where they are confident to live. And when they're confident living, things start to go well in their lives again for them. And that, for me, is one of the most satisfying things about what we do at Smile Texas.
Okay, good. Now, we should mention, because you are the teeth by tonight guy.
Yes.
Okay, you invented that, right?
Yes,
Created that.
I did.
So there are people that go in without teeth and walk out with teeth.
That is
And that's true.
the majority of what we do.
Is that right?
That is the majority of what I do. 95% of what I do is that same day transformation for those patients.
Okay, good. I want to thank you for coming on the show. Always a pleasure. In fact, we've wanted you back for quite some time, so thanks for coming.
Thank
back
you
on
for
the
having me,
program.
Randy. Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.